Hey, Dr. Duran here, and welcome to another episode of Scrubs and Software. We took a break last week. I was at ASEP 25, American College of Emergency Medicine Physicians Conference in Salt Lake City, Utah, and ran into a bunch of innovative companies using AI to solve some of the challenges that we have in emergency medicine. Thanks again for tuning into this series. Once again, if you have an app, piece of software, something solving something in medicine that is machine learning or AI focused, and you want me to create one of these episodes around, send it my way. Today's episode is around an app called TriageGO, software called TriageGO used for the ER. And essentially, what they do is they helped with setting acuity levels, right? So we're all familiar with level 1, 2, 3, 4, 5. That is really important in triaging of patients, right? So if you have a patient who is maybe a level 4 that could go to fast track, but they get classified as a level 3, they're going to likely take up a main ER bed. And as we all know, ER boarding is a huge issue. Rooms are in short demand. And so ensuring that patients get classified correctly is important. Same thing goes for someone who's a 3 that maybe should be a 2 or even possibly a 1. Them getting triaged could be life-threatening. They could be the patient that ends up having respiratory distress or a seizure or ends up coding in the waiting room. We've all been in those situations. This is a company that was founded and a piece of software that was invented at Johns Hopkins a couple years ago. They essentially, what they do is they integrate with the EMR that you're using at the hospital that you're at. They will look at 2 years of previous data, train off of that, and that is the starting off point. Now, it is obviously machine learning, and so as you kind of use it more and more and more, it'll get more optimized to the patient population that you are working with. So this is kind of what it looks like. Basically, it gets integrated into the EMR. So this is an example patient. So this is a 27-year-old that's coming in with fatigue. You can see their blood pressure is normal, their O2 is normal, their heart rate's normal, respiratory rates are normal, temps normal. So everything's normal. So normally this would be a level 3 or 4. So it looks like on this one, they classified this patient as a level 4. I think that is reasonable. It could be like a viral syndrome or something. There weren't any red flags. I'm going to fast forward a bit, and what they show in the kind of next step is the inputs, right? So it takes into account chief complaint, vital signs, demographics, how they got there, EMS versus POV, any medical history. There's a learning algorithm, and then it gives you the level of acuity. I'm going to fast forward here a bit, and they're going to show a similar patient with similar vitals and complaints and everything, but this patient's a 71-year-old, and so we all know that anyone who is in that age bracket and demographic going to be higher risk, and so this one it shows gets triaged as a level 3. There's a few things that stood out to me. One, I always love a company that has published papers and evidence. They did share some of those with me. So in 2025, this year in New England Journal of Medicine, they published a study that showed a 16-minute decrease ED length of stay, 84-minute decrease time to ICU and OR, 92-minute decrease time to admission. That was impressive. They also published something in JAMA in 2024 showing decreased time to cardiac cath for emergent cardiovascular interventions. And my personal favorite, obviously you all know I talk about health equity and the biases that we have in healthcare a whole bunch. We all know that it exists. Obviously none of us are personally biased, but there are systemic things in place that lead to issues. And so in the Annals of Emergency Medicine in 2024, they published something showing mitigated bias for Black patients, Hispanic patients, non-English patients, and they quoted some numbers there that were fairly impressive. And so I think this is very important, obviously, especially in those times where, you might have 1 or 2 triage nurses and 5 or 10 patients check in over the course of like 30 or 40 minutes. That is going to be, a lot of work on them. They obviously still have to go through all of the steps and everything, but having an aid and something that is trustworthy, kind of helping you look at some of the history that maybe you aren't looking at up front and helping you make some of those decisions, I think will be important. I think also this could be useful in a setting where you have an experienced triage nurse who is kind of going through their thing, and then maybe one that is less experienced, kind of seeing patients that look like they may be lower acuity, and this kind of helping them guide things that may be perhaps higher acuity, or something that maybe they think is higher that might be lower. Once again, I think this is my favorite type of tool. These tools that are not necessarily making like heavy clinical decisions, but tools that kind of look at these large patterns and ensure that the patient goes to the right place, that time is saved, that patients that need to be seen first are seen first, and it's something that is not, once again, replacing nurses, it's not replacing doctors, but aiding them in making sure that patients go where they need to go, and that the healthcare providers that need to see the patient see them. I think this is an innovative company. Looks like they have launched at various emergency departments across the country. Some of the numbers and cost savings and things of that nature are fairly impressive. But yeah, hopefully this was another cool piece of tech that you think you may want to look into or learn more about. And if you've once again got something that you want me to take a look at or give my thoughts on, happy to do that. Thanks for tuning in, and I will share another one of these next week.